Not long ago, Lindsay Brown wasn't sure she could continue playing the sport she loves.
Oh man, you're hot now.
Button.
Warren Henderson couldn't dress himself.
Okay.
Sharon Bossy didn't trust her grip on a cup of coffee. And Linda Holland couldn't use her left thumb for anything at all.
If you don't have a thumb, all you have is a fin, essentially. I could hold things with my hand, I could push them back and forth, but I couldn't hold them with thumb and fingers to get a grip on anything.
Whether the damage happened through injury, genetics, or just wear and tear, all of these people needed help to recapture their former quality of life.
I'm right-handed, and I can't eat with my right hand. I can't shave with my right hand. I can't comb my hair with my right hand. And then it's limited to the distance it'll move this way, and it won't straighten all the way out. It will straighten only this far.
For Warren, Lindsay, Sharon, and Linda, surgery was the solution. Each had a different physician, but those doctors are all part of the hand and microsurgery team at UW Medicine.
It's a consortium of surgeons who have had special training in hand surgery from various backgrounds, and half of us are from a plastic surgery background, half of us are from an orthopedic background, some of us have done special training in microvascular surgery, and all of us on this particular team do replantation and microvascular surgery. So we all share in the call, we all share in our special interest, and we all make sure that we cover each other in our various interests.
I usually take out the trapezium.
These hand team surgeons practice at Harborview Medical Center and the University of Washington Medical Center. Warren Henderson found himself at Harborview after a car pulled in front of his motorcycle, sending him into a frightening crash. He remembers the accident clearly, including the loss of his new leather jacket.
It was lucky that I wasn't killed in it. But the other interesting thing is, I was wearing a helmet, of course, because we have to, but I didn't hit my head. And so I was conscious during the whole thing. And I remember telling the aid car people when they picked me up, "Don't cut my jacket off. Don't cut my jacket." And of course they did.
You'll have to put up with my tying.
Okay.
Orthopedic trauma surgeons repaired the damage, but over the next few months, bone spurs developed in Warren's elbow.
That's the best I can do.
Well, I guess I can't complain then, can I?
Any time that we have a musculoskeletal injury, there's bleeding, and that bleeding becomes a clot. Within that clot are cells that are called pluripotential cells. And given the information in the environment, that will either choose to become bone, or it can choose to become fibrous scar. If it is surrounded or immediately adjacent to an area with very, very high blood supply, such as the knee and the elbow, lesser degree the hip and the shoulder, the information can come to those pluripotential cells and says, you know, you look like you really want to be bone because of the fracture surface of the bones that were repaired. And it's just like the hinge on a door. So if I put a stop on a door, it can only open so much because of the stop. And our whole surgery was designed to take the stops out of the hinge.
Besides his stiff elbow, Warren lost feeling in two of his fingers and part of his forearm due to a damaged nerve.
Since I can't feel it, what happens is that, see, it'll hit both of them, and sometimes it hits, when I want to hit E, it hits F.
After his surgery, Warren hopes to be able to accomplish the basics of life by himself again, like combing his hair, brushing his teeth, and getting dressed. He's also concerned about getting a new motorcycle. After all, he's been riding one for 30 years.
I'd like to be able to regain the strength that is in the right hand. And the reason for that is that when you ride a motorcycle, your throttle is on the right.
And so Warren returned to Harborview for surgery with Dr. Doug Hanel.
I want to stay there because they have the expertise that will be able to correct this problem better than any of the other facilities that we have here in the state of Washington.
We're actually trimming and cutting the bone and removing parts of the bone that are keeping the elbow joint from bending. And we're reconstructing the anatomy that was the normal anatomy so that the elbow joint could work.
In concept, it's a simple operation. In practice, it's actually quite difficult. Few doctors care to perform it.
I think we're going to go after the capsular here and the capsular scar first.
Okay.
Then we'll go after the bone right here. The reason that this is a procedure that isn't done by very many people is that it's not terribly easy. You're dealing with scar structures. You have to dissect through scars. You don't get to use a tourniquet. And the reason we don't use a tourniquet is that it allows us to identify the bleeding structures or the potential bleeding structures, and we will coagulate those and keep those from bleeding or reforming a clot that then can turn into bone again.
Dr. Hanel performs at least one stiff elbow operation a week, sometimes 2 or 3.
We come into the front of the elbow, we protect the critical structures, we get underneath the muscles that make the elbow joint flex, and then we find the scar, and the scar bone and the scar capsule. We remove that, and the reason that it takes us particularly long is that as we come across over to this side, there's some very, very important nerves that account for and are responsible for making our fingers extend and our wrists come back. And so we have to protect those while digging out a piece of bone that is going across the elbow into the forearm.
Okay, Dr. Hanel. Oh, yeah. I have your images up.
I like it.
It's good. Good job.
Thank you very much.
And when the surgery was complete, the team carefully realigned Warren's tattoos, another of his preoperative concerns.
We can line up tattoos. In patients that don't have tattoos, we put a skin marker on it, and we put hash marks on that, so at the end of the procedure we can line up the hash marks. All we have to do with him is line up his tattoo.
More importantly, of course, Warren can bend his elbow again.
It's such a dramatic improvement over what it was. And any of it would have been an improvement, but it's beyond what I had hoped for.
In young people, broken bones may have serious consequences when a growth plate is involved. Growth plates are a more fragile area where, as the name suggests, bone is actually growing to its adult size. Lindsay Brown fell during a basketball game and broke the radius bone in her wrist. She was 12 years old, and that bone was still growing.
It happened when I was in 6th grade. I was playing basketball, and it was my first basketball game, so I was really excited. So when I got into the game, I tried to intercept a basketball from the opposing team, and I lost my balance as I was coming back down, and I used my hands to brace myself. And so my left hand was the only one that actually got hurt. My right one was fine.
The original fracture healed, but the stage was set for future problems.
Depending on the extent of the trauma and the pattern of the fracture, the growth plate may either continue to grow if it's properly aligned and everything and there wasn't a significant trauma, or it may actually stop growing. And one of those growth plates for the arm is located right at the wrist in a bone called the radius, and it's very prone to sustain injuries there with just a fall on an outstretched hand that we call it. And that's what happened.
Over the next year or so, one bone in Lindsay's wrist continued to grow while the other stopped.
Over time, because the one bone stopped growing, the other bone started jutting out, and it just got worse and worse, and as it increased in being misaligned, the pain increased.
Lindsay had developed a radius malunion in her wrist. That's when her doctor referred her to the University of Washington Medical Center.
When she came to see us, she had already developed a significant deformity of her wrist, and although she didn't have that much pain, in the future would have been a big concern for her, developing pain and arthritis.
Dr. Thomas Trumbull discussed surgery with Lindsay and her parents.
Once someone has healed in a malunited position, as Lindsay did, it requires a fairly dramatic surgery to bring back her correct anatomy and restore her function.
He was pretty matter-of-fact about, this is probably going to require something. And then his physician's assistant, who is the lady that stayed with us through the whole process, he told her, he says, could you go get my book, please? And they went and got his textbook that he had written on this surgery, and they went to page something, 540 or whatever. Opened up the page of the book, and there was the exact kind of surgery that he was going to perform. That was an immense amount of comfort.
Lindsay's surgery actually involves cutting or re-breaking her bone. This, of course, is done surgically under anesthesia. This re-breaking allows us to distract or pull her bones back out to length and readjust the shape and alignment. We replace the missing bone with new donor bone and give her the time and support she needs to grow her own bone into the donor bone. It's a lot like Ivy creeping onto a lattice work. Her own bone grows in, replaces the donor bone, and ultimately it all becomes Lindsay's bone. And this is supported by using a special metal plate. Lindsay only needs this plate for as long as it takes her bone to grow in.
The plate is sort of splinting that bone, just like a cast would do, but right on the bone and stronger than cast because it's metal. And if you look from the side, this long white line here, this is metal from the plate, so you only see the plate in profile, and you see all the screws now that go from the underside of the wrist to the opposite side of the wrist. Multiple screws here and multiple screws near the joint surface. Now when you look on the view like this, you only see the head of the screw, but you see the plate now head on.
While Lindsay had outpatient surgery, her dad sat patiently in the waiting room.
There must have been 3 or 4 other complex hand surgeries being done, which was quite amazing to me because I was talking to some of the patients, or the relatives of the patients, and the things that were being done just amazed me at how they could reconstruct and redevelop somebody's hands and joints in day surgery.
I'm just happy that I got a doctor that really knew what he was doing before the surgery. He kept reassuring me that it'd be okay, and because I was really scared about going under, not being completely knocked out because I didn't know what was going to happen. I didn't know if I'd wake up again, and so I'm just happy he really reassured me and made sure everything would be okay.
All right, pass yourself, set to your partner.
Lindsay healed in time for volleyball season, about 6 months after surgery. She's no longer playing through the pain.
Yeah, it's gone. No pain. I just tape up when I play sports and it's fine.
She's gone back to a very, very high level of play, and that's what we were hoping for, and that's what she's achieved.
So what we're planning to do is we'll make a little incision there after they've numbed up your whole arm, and with the scope, look on the underside there, and then be able to divide the ligament that's pushing on the nerve, so take the pressure off the nerve. We'll then stitch it up, put a bandage on, you go home, take the bandage off tomorrow, put a Band-Aid on.
Sounds good to me.
Sharon Bossy has carpal tunnel syndrome. She's depending on surgery to make her right hand useful again.
It's a constellation of symptoms that patients get that usually is predominantly numbness and tingling in the fingers, and it's mostly the thumb, index, and middle finger. It often is associated with people who do a lot of things with their hands, repetitive activities.
It's just like if you were to sleep on your arm or something and you wake up and it's kind of tingling and you just shake your hand a little bit or something like that. It's like that all the time.
It doesn't hurt, but Sharon can't trust her hand.